Hello, I am Professor Dr. Syed Arshad Husain. I am Professor Adjunct in Pulmonology at the Gulf Medical University. I'm also a Senior Clinical Lecturer at the King's College Hospital. Today I'm discussing a very important topic, and this topic is the effects of pregnancy on asthma. So we know pregnancy can affect asthma, but we also know that the asthma can be adversely affected during pregnancy at times. So asthma can have bad outcomes in pregnancy, and that's why the asthma has to be controlled well. Now, in pregnancy, sometimes the asthma gets better in 1/3 of cases. Sometimes asthma becomes worse in 1/3 of cases, and sometimes the asthma remains completely the same in 1/3 of the cases. So the pregnancy can have different effects on asthmatics, but the very important message is to understand is that they should continue with the regular asthma treatment, which includes the usual inhaled corticosteroid inhalers, which are combination with long-acting beta agonists, and also the antimuscarinic agents. They should continue with these inhalers, and they are very safe in pregnancy. But when it comes to the leukotriene inhibitor, which is Montelukast tablets, and that there is no evidence of safety in pregnancy. So hence, the Montelukast should be stopped if you are pregnant and you're an asthmatic. It also happens that people who are pregnant sometimes develop shortness of breath, and that could be because the diaphragm is the baby is pushing the diaphragm and the lungs are a bit compressed, and so a feeling of breathlessness can happen. But if they develop asthma during pregnancy, which they did not have before, they would again be requiring inhaler treatment to get the symptoms settled. And as we know, the symptoms of asthma are cough, shortness of breath, chest tightness, and wheeziness. Now, the asthma control is very important. Equally, it is very important that if you are a smoker, you stop smoking during pregnancy, because there are hazards on the baby if you continue to smoke. There are hazards to the asthma if you're smoking, so it is very important hence to stop smoking. The other important aspect to understand is that during the pregnancy, the asthma should be closely monitored with the pulmonologist, and the pregnancy and the fetus should be properly and regularly monitored by the obstetrician who is looking after the pregnancy. The reason we do a close monitoring in pregnancy is to make sure that the asthma is not uncontrolled. And it is also important that when we are reaching the expected date of delivery for the baby, there is nothing to get concerned. Usually the sympathomimetic goes up and does not cause asthma to be worsened during the time of delivery. But if there is any concern of the asthma is severe, then sometimes we give you steroid tablets a week before the expected date of the delivery, or sometimes at the time of the delivery, hydrocortisone can be given intravenously. And again, these all drugs are safe, apart from one drug which I've talked about, which is Montelukast, which is not safe to be used in pregnancy. And again, we try to avoid X-rays in early trimesters of pregnancy, but if X-ray is very much required, we can use lead protection to do the X-rays if needed. The last thing I want to say is that, I would like to encourage all pregnant ladies who are asthmatics to have, after childbirth, breastfeeding to their children, because breastfeeding has positive effects in preventing asthma in the offspring. We know there is a genetic link in this disease, and it can be forwarded from the parents to the children through this genetic link. So giving breastfeeding to the children or babies is very important. It gives them some degree of protection to prevent asthma happening. So I hope we've covered this topic of pregnancy in asthma well today. Thank you.